Good morning. Am I audible? Good morning. Am I audible? Great. Good morning, all. We are starting our reading club with a prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जैसे पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning, all. We are giving tribute to our great master, Dr. Samuel Hahnemann, for this wonderful divine science and taught us that to be wise. Seeking blessings from our Guru, Dr. Prafull Vijayakar, sirs, who have made this divine science connect with the modern science and made homeopathy easy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijayakaraय Namah. Friends, we are in the journey of reading Organon of Medicines by Dr. Samuel Hahnemann, 6th editions, along with the theory of acute by Dr. Prafull Vijayakar. The wisdom of Organon of Medicine help us to deal with the cases in our day-to-day practice. So up till now, we have covered in Organon of Medicines the theoretical part from 1 to 70 aphorism, followed by the understanding of the disease in different aspects and the case taking part. And now we are reading the few wisdom about the drug proving. So continuing the aphorism from 134. In before aphorism, it was found that most of the things, Hahnemann was the first to found out the path of the proving. Then he made about the primary actions, alternating actions, and everything. Now, the further understanding in the drug proving, that is all external influences. In yesterday's sessions, we have seen that whenever any symptoms arises, you have to find out the modality related to that symptoms by changing the demeanor in form of the eating, drinking, or in the form of the positions, or noting the time of the symptoms appear. So this is what the modality gives you a completeness. So in further to this, all external influences and more especially medicines, possesses the property of producing in the health of the living organism a particular kind of alterations peculiar to themselves. But all symptoms peculiar to medicines do not appear in one person. Very important thing is all symptoms of the medicine do not appear in one person, nor at nor all at once, एक साथ में भी नहीं आ जाते, nor in the same experiment. So एक बार drug proving किया तो सब symptoms नहीं आते, subsequent drug proving many experiments gives the idea. So our materia medica pura is not the single person's proving, it is a proving of the many symptoms and many persons with the many experimentation. So that is what the collective symptoms of everything, but some occur in one person chiefly at one time, other again during the second or the third trial. So this was the second and third proving. In another person, some other symptoms appear, but in such a manner that probably some of the phenomena are observed in the fourth, eighth, and the 10th person, which had already appeared in the second, sixth, and ninth person. So this is what many a time the repetitions of the symptoms happen in a further experiment. So that is what giving a more importance and so forth. Moreover, they may not recur at the same hour. So sometimes it is possible that एक प्रोवर में एक नाइट में एग्रावेशन बता रहा है, दूसरे प्रोवर में मॉर्निंग में एग्रावेशन बता रहा है. तो दैट इज नॉट द थिंग, बट इट इज समथिंग दैट इज अ कलेक्टिव सिम्टम्स ऑफ द प्रोविंग. The whole of the ailment of the disease a medicine is capable of producing can only be brought to anything like completeness by numerous observations on the suitable persons for both sexes and of a various constitution. So here it is very important that the whole we need to understand the wholeness of the medicinal actions, so that it is not like that it has to be proved in only one person. It has to be proved in many provers as well as the numerous observations as well as in the both sexes also and a different kind of constitutions also. We can only be assured that the medicine has been thoroughly proved in regard to the morbid state it can produce, that is to say, in regard to a pure power of altering the health of men, when subsequent experience can notice little of the novel character from its action, and most always only the same symptom as had been already observed by others. हम कब कह सकते हैं कि हमारा प्रूविंग खत्म हो गया? तभी कह सकते हैं जब मल्टीपल एक्सपेरिमेंट करने के बाद हमें एक जैसे ही सारे सिम्टम्स जो प्रीवियस सिम्टम्स आए वही आने लगे और कोई ऐसा नया सिम्टम्स नहीं आता, तब जाके हम कंसिडर कर सकते हैं कि हमारा ड्रग प्रूविंग थरली ड्रग प्रूव हुआ है. As has been said, although a medicine on being proved on a healthy subject cannot develop in one person's all the alterations of a health it is capable of causing. So again, एक persons में सब symptoms नहीं आते, but can only do this when given to many different individuals varying in their corporeal and mental constitutions. Yet the tendency to excite all the symptoms in every human being exists in it according to an internal immutable law of nature, by virtue of which all its effects, even those that are but rarely developed in the healthy person, are brought into operation in the case of every individual if administered to him when he is in a morbid state, presenting similar symptoms. It then, even in a smallest dose, being homeopathically selected, silently produce in a patient an artificial state closely resembling the nature disease, which rapidly and permanently or homeopathically frees and cure him of his original malady. So here Hahnemann has mentioned that अगर जो भी सिम्टम्स पेशेंट में डेवलप होते हैं वही सिम्टम्स अगर नेचुरल डिजीज में और मॉर्बिड स्टेट में कोई पेशेंट लेके आ रहा है तो हम यही प्रिंसिपल होम्योपैथिक प्रिंसिपल लॉ ऑफ सिमिलिया अप्लाई करते हैं तो क्या होता है कि वो रैपिडली परमानेंटली उसको ठीक कर देता है क्योर हिम एंड फ्री हिम फ्रॉम द ओरिजिनल melody. So here again he mentioned about the modus operandi as well as the law of similia. So, friends, this is the few wisdom of our drug proving and understanding of our masters. We are understanding our masters' words in our day-to-day practice. So, considering the understanding of the theory of acute, so up till now we have covered the basic principles of the homeopathy in this book, as well as we have understood the practical part or the practical materia medica part. That in this we have to understand how the patient presented to us. So we need to understand the man in a disease, not the disease in man when the patient encounters with the acute disease. And when there is acute disease, we need to consider the patients in the five elements of the fire, earth, air, water, and the ether. So this is what we consider as the activity thermal thrust axis. So Dr. Vijayakar sir has made this wonderful for all of us to easy prescribing in our day-to-day practice. So coming back to the book that up till now in this book we have covered the phenomena of dull. So the remedy we are covering here is the dull, hot, and thirstless. Here we know that the in the previous sessions we have covered that the activity has been reduced drastically in terms of the sleep is overpowering. So if the sleep is overpowering and person is going into sleep, then the different kind of medicine. Then we have another filter. That filter of the person is not going into overpowering sleep, but person is going into a dullness or what we called as his activity has been reduced to certain extent or his voice of tone has been reduced to certain extent. So that suggests the dullness. And dullness is encountered followed by we have to apply the filters of the thermal, followed by we apply the filters of the thirst and some PQR. So, in case taking part, what we have to considering is this chapter. According to Dr. Vijayakar sirs, we have to find out the activity, the thermal, the thirst axis, plus diligent or non-diligent, plus PQRS of the patients or the change disposition. So, if we get few of these phenomena, then we apply this into our practice and use this chart very beautifully. So, in this chart, we are here to understand the persons having a dull, hot, and thirstless. So we have a few remedies like pulsatilla, bryonia, lycopodium, apis, opium, thuja, and carboveg. As per Dr. Vijayakar sir's clinical experience, sir has made this remedy to understand in acute state. So whenever you apply these filters of the dull, hot, thirstless, and then uh, we go to our chart so that we can use it very beautifully. So whenever we apply these filters of the dust dullness, then the hot, and then the thirstless, so we have a few remedies like Pusitilla, Bryonia, Apis, Leprosy, Sulfur, like Pothuja, Opium, Carbovage, and everything. So whenever we apply this filter, we need to add some PQRS in this condition. So the PQRS filter is that to observe the patients with the mouth. If you find the person is dull, hot, and thirstless, so then ask the patient, open your mouth and check the mouth. If the mouth is moist and the tongue is moist, you have a different filter remedy. If the mouth is dry, yet there is no thirst, then the different remedy is there in the list. So This is the filters of the PQRS help us to understand in a quick and easy prescriptions when you have the axis of the dull, hot, and thirstless. After that, a dull, hot, thirstless, and the person's having a dry mouth yet no thirst. So we have the pulsatilla, bryonia, lyco, apis, opium, jujine, carbo, veg. Then apply the filters of the diligence and non-diligence. So if you apply the filters of diligence, you have a different set of remedy, and if you apply the filters of non-diligent remedy, there is a different set of remedy. So we are starting with this process that the dull, hot, and thirstless, along with the dry mouth, and along with there is no thirst and the diligent remedy. So we have a two remedy, that is the bryonia and lycopodium. Now we understand that bryonia. What is the bryonia feeling? The bryonia is the dryonia. So dryness of the mucous membrane everywhere. The days are hot and nights are cold are the peculiar modality associated with the bryonia. And the bryonia is the remedy of the materialistic world. So he always talks about the business, 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 money, and he wants the safety and security. And the most PQRS symptoms of the bryonia is the motions aggravate and rest ameliorate. So this is what the few symptoms of the bryonia. So we are going into this. So the filters of the bryonia suggest that the person's having an axis of the dull, hot, and thirstless. Sometimes you find that bryonia in thirsty also, or sometimes you find bryonia in verbal or mental activity has been increased. So in mental activity, when increased, there is you should find that the person is talking deliriously about his business, business, and business only. So this is something you have to think about the bryonia. So bryonia has the concomitant symptoms is the lies motionless because the motions, the slightest motions aggravate and absolute rest ameliorate. So whenever you observe the patient, he cannot move at all. Even a small movement of his eyeball or a small movement of the eye makes him worse. So this is what you have to understand: the lies motionless. There is a dry mouth and a thirstless, and the modality, that is the pressures ameliorate. So these are the three key pointers. Along with there is dry mouth with no thirst, or in bryonia there is a thirst also, and thirst for the large quantity of the cold water at long interval. So that is what one of the another indications of the bryonia. There is a dryness at the level of mind, the dryness, the listless, irritable peoples, and lying on emotionless. Again, bryonia is there in another set of symptoms, what we call as aorta, angry when obliged to answer. So, bryonia does not want or give answers whenever they ill. So they, and again one of the phenomena, that is the disturb aversion to. They don't want to be disturbed. So this is what the few symptoms of the bryonia when the bryonia patient encounter in your clinic. They are dull but not sleepy. There is a severe body ache, but body ache is relieved by the pressures and aggravated by the motions. Dryness of the mucous membrane gives rise to a constipations, and there is a hardness of the stool. Always think about the business, 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 and the bryonia is diligent, so he is more concerned about his business and he is diligent in his business. Most of time the bryonia, the seat of bryonia actions on the liver. So there is one of the concomitant symptom which I found in most of the fever cases is the bitter taste in the mouth fever during, and it is affecting the liver. So the emotion which is involved is either the anger and the mortification. So this is what whenever you find that the anger mortifications with the dryness, with the dull, hot, thirstless axis, which lies motionless, and it talks about the business and the materialistic personality, you can directly think of bryonia. Again, you know the bryonia is diligent and conscientious. It can also be found in dull, hot, thirsty. The same phenomenon is there. So the bryonia. So whenever you find that there is a dryness of the mouth yet no thirst, and the person is diligent and talking about the business and lies motionless, the remedy is bryonia. The another remedy that we think about when the diligence is there with the dry mouth, with no thirst, and the dull, hot, thirstless axis is the lycopodium. So indications of the lycopodium is when in acute also as well as in a chronic conditions, when you ask about or ruling out the persons, you ask that if you like the warm food and warm drink, then the indication lycopodium is ruled in. So here the very important aspect that lyco wants warm food and drinks. So the axis associated with the LICO is dull, hot, thirstless, as well as the thirsty axis. And you all know that lycopodium is very, very conscientious, diligent, and studious kind of personality. So when there is a fever, they like to study, they like to do their works in a proper way. There is a desire for the hot foods or desire for the warm foods, and they being angry on the inferior, and they are very mild, timid on the superior. So there is one phenomena which is called as hard on inferior and soft with the superior. So this is what the lyco personality is. So it can be also found in acute state also. Even in acute state, there must be a dominating kind of personality dominating on the physicians also there in lycopodium in acute conditions. So there was one to insanity dictatorial. So he want to dictate everything and they wanted to get the relief. So this is what something you can find out in a syphilitic state when the lycopodium comes to you. They love to study books and knowledge, desire for the warm foods, hot foods, desire sweets. We all know the trademark of the lycopodium is soft with superior and hard with inferior. Most of time the lycopodium cannot smile. They are serious looking peoples and never smiling child. Another remedy that is the ammonium. They also having a never smiling children. So this is what lycopodium and ammonium. Again, lycopodium, you find that in the children, you find the bossy forehead. So this is what the lycopodium is the one of the remedy. The anger with timidity surface on the face as the doctor approaches to the examine because the lycopodium is a remedy for the anticipatory anxiety. And most of time the anticipation ailment from is the indication for the lycopodium and the Helperia carp. So most of children fall ill when they having examinations. So this is what you can think of. The hot patient who loves the hot food and hot milk, and adult who are always keen on thorough investigation. So many a times the persons comes to you and they always say that please doctor do investigation. We will have taking no rest, so you can take the advice investigation. I will go for the investigation and then you start the treatment. So this is what the lycopodium person is. Whereas the sulfur, whenever you advise the investigation to sulfur, sulfur will एक्सक्यूज यू एंड टेल यू दैट ओके सर आपकी दवाई बहुत अच्छी आती है मुझे मेरे मालूम है 100% आपकी दवाई से ठीक हो जाएगा अभी आप इन्वेस्टिगेशन मत कराओ मैं देखता हूँ 2-3 दिन बाद सो सल्फर नेवर डू फॉर इन्वेस्टिगेशन whereas lycopodium always go for investigation and they are being treated very easily. So this is what the indication that a dull, hot, thirstless with a dry mouth with the diligent filter, then we have a brania and lycopodium. The same phenomena, the dull, hot, thirstless, and the non-diligent filters with the dry mouth, then the remedy is pulsatilla, apis, thuja, carbovage, and opium. So as we all know that opium we have studied in the chapter of the sleep overpowering, that after waking the actions is very quick, opium is contented and does not complain, and there is sleep overpowering. So this is what something you can think of when the person is dull also and there is no desire and the contentment, the opium is the remedy. So we are not going into detail of that because already we have learned that whenever you found out that there is a dryness of the mouth without thirst and dull hot thirstless, the first remedy comes into your mind is the pulsatilla. And the pulsatilla, when the present in your clinic, they are very very mild, yielding, and always weeping, and they want and seek consolation from the physician. So whenever you console that you will be all right soon, I will give you medicines, and they feel better. That is what the pulsatilla is. Pulsatilla wants to be carried. So there must be things that they want to be carried very slowly so that they get attentions and they get consolations so that they can feel better. So this is what the pulsatilla in acute state. The modality of the pulsatilla you can think is the pulsatilla is very changeable remedy. So the modality has been changing. Sometimes he feels the chilly, sometimes he feels the hot. So the more changeable modality is there. But in the bargain of everything, they want the consolations from the physicians and everyone around them. So if they are given consolation, they feel better. There is a dry mouth, yet no thirst, very irritable, but they having a weepings and crying and always wants to be carried. So most of time they comes with the mother. They are very mild, meek, weeping, wants mother near, caring and consoling. So this is what something the pulsatilla disposition is. Again, the pulsatilla children, whenever the children comes to your clinic, they are always crying and weeping, and the cry is something which we call as a piteous cry. So you love that कि हम बच्चे को खेल लगाए. पर कई बार अगर कैमोमिला और सीना बच्चा आता है और क्राई करता है तो तुम्हें ऐसा फीलिंग होता है कि क्या इस बच्चे को मैं कैसे शांत करूं, इस बच्चे को मैं मार के शांत करूं. So that is what the feeling if you get, then the remedy is different, the chamomilla or asina. But when the child, you feel that you feel the sympathy towards the child, then the child can be a pulsatilla. This is called piteous cry. Another remedy, there is a piteous cry, another is arsenic alb. So you can think of this remedy in this way. Whenever the children comes to your clinic, they cry in the clinic, and when someone carried out them outside the clinic, they become quiet. So this is what something they loves open air and wants to go out and wants door and window open. So this is what the pulsatilla observations in the clinic. There is a changeability. You all know the pulsatilla is the remedy of the changeability. There is the thermal has been changed, the thirst has been changed. So yesterday they felt chilly, today they felt hot, again they felt thirsty in the morning, thirstless in the evening. So this is something we have to understand the changeability of everything in the person. There is one phenomena that is sorosyphilitic phenomena. Most of time the persons having the mourning during the fever. The involuntary mourning during the fever, it is the indications of the pulsatilla along with the dull, hot, thirstless axis. And you all know that yesterday I told you that whenever the person's having a rich food aggravations or the person who desire ice cream is a phosphorus, and persons who have aggravated after the ice cream, cake and pastry, that is what we called as pulsatilla. So most of time the diarrhea from the rich heavy foods or heavy fried foods or sometime after the pastry, cake or after the ice cream, then you can directly think of pulsatilla. So this is what the indications of the pulsatilla. Again, pulsatilla is there in the mental axis also. There is anxiety plus because of the weeping, irritable nature, hot and thirstless. So in that also we can think of pulsatilla along with these indications. Filter of the dull, hot, thirstless, along with the dry mouth with no thirst and non-diligent, and the consolation does not affect him, but the person is seems to be a very mild but angry in nature and having the urinary complaint with the frequent urging to urine. So this is what the physical PQRS of the person that you can think directly of the remedy apis. So you all know the apis. Apis is prepared from the honeybee. The indications of the apis is indicated in the sauropsychotic conditions where the psychosis is overwhelmed by the swelling, edema, and bag-like puffy swelling. So there is a puffiness with the dull, hot, thirstless, or sometimes thirsty, as well as the axis of the mental anxiety, hot and thirstless. You can directly think of the apis. You all know there is a edema associated with the urinary symptoms, and the person who is very angry and dominating. So in acute conditions, the appears become very angry, dominating, and the jealous person. So I will share one of the case of this remedy. One of the patients in my nearby clinic in the market area. So she is a vendor of the hosiery clothes. And she came one fine day with a complaint of the fever and the dullness and having a urinary infection. She used to have a frequent urination and everything, burning micturations. So I generally when the urinary tract is infections or the frequent micturition is that as per the conflict theory, we can find out that someone is there in their territory to be intrude into that. So she like to mark the territory, and that's why the urinary tract has been overactive and the frequency of urination has been increased. So in that case, I asked about what happened, what happened. She denied initially, nothing, sir. Please give me medicine. The irritability on the face and everything is there. But then finally, I asked something is happened during the business work, so she said that yes, sir, it happened. So I asked what happened. So she said that whenever I used to sell hosiery clothes in my shop, and in front of my shop, one of the hosiery sell vendor are sitting there, and he used to sell the same. So there are the customer going from my shop to there. So she feels jealous about that, and after that emotion, she got angry on that vendor, but she cannot express on that, and that is what she developed the urinary tract infection. So on the basis of that, I took the ailment from jealousy and dull, hot, thirstless axis along with this angry, dominating nature. So I prescribed the APs, and within 3 days, she was absolutely fine. All the symptoms went away. So the indications of the APs is angry, dominating, and ailment from jealousy. There is a sadness, indifferent, and a stuporous condition when they goes into syphilitic state, a zoosyphilitic state. Most of time you can find out the swelling over the face, swelling over the eyelids, and the frequency of the urine increase, but there is a scanty urine. So the kidney affections is the most keystone of the APs is the remedy. So loss of speech or inability to talk. So aphasia with the fever, it is very important. PQRS, physical PQRS in the APs, there is aphasia with the fever. And many a time due to sadness and indifferent state, they does not complain like the sepia, but the sepia has a dull chilly thirstless, whereas dull hot thirstless you can think of APs. And shrieking in the sleep, whereas moaning in the sleep is pulsatilla, shrieking in the sleep is APs. So you can generally differentiate from the very small point, and you can prescribe the remedy accordingly. So when we find out the filter of the dull, hot, thirstless, and dry mouth, yet no thirst with the non-diligent filter, you can think of another remedy, that is Thuja. Thuja can be diligent, can be non-diligent. Apis can be diligent, can be no, because Apis is very industrious in psychotic, so they can be diligent. But Thuja is also diligent and non-diligent because Thuja is the king of psychosis, and when there is a king of psychosis, psychosis is the law of psychosis is to cheat everyone. So there is manipulations, and that manipulations lead to non-diligency. So this is what something you can think of the Thuja. So Thuja, the main feeling of the Thuja is the feeling of being a frail or a fragile, and to overcome this feeling, they become very cautious about their thing, and they want safety in their environment. So this is what the Thuja. So Thuja can be diligent, Thuja can be non-diligent, both the dull, hot, thirstless, and there is a cautiousness, the indication because of they feel fragile and everything. And again, in acute condition, you find out there is most of time you have to advise administer Thuja when there is an ailment from vaccination. So I had a case of fever during the COVID conditions. After the COVID, he developed a fever because previously he used to have a COVID, and after that he was recovered and he took the COVID vaccinations. And after COVID, he developed again the fever on the basis of dull, hot, thirstless, and diligency because he used to go to the work. So I prescribed ailment for vaccinations and I prescribed Thuja. The next day his fever went away and he was fine. So this is what something you can think of in your clinic. So Thuja is very delicate but a fatty and stout children or a fatty personality because it is a king of psychosis. The cautiousness is found in everything, so he can. So most of in children, they do not want to jump, or he walks very cautiously so that he cannot get any injury because of there is a real sensation. There is the irritability and the crankiness. So most of them you can find out that irritability in the morning AM. So 5 a.m. to 10 a.m. The crankiness is found in the. So many a time you find out the children wakes up and the crankiness. The two remedy you can think of, one is the lycopodium and another one is the thuja. And the ailment from vaccinations and insect bite, the remedy to antidote it. So this is what the thuja is. So whenever you find the dull, hot, thirstless, along with the dry mouth, yet no thirst, and the non-diligent filters, you can think of another remedy, that is a carbovage. So you know that the carbovage in acute conditions, having a shortness of the breath and wants everything in motions and wants fan in nearby. So this is what the indications of the carbovage. So carbovage wants air in motion because the slowness of the circulations lead to the stasis in the whole system. So carbovage patient is psychotic, but when they comes to in acute state, you will find that they want fan very from near. There is a stasis of the all system, the slowness of the circulations, and the feeling of unfortunate he is. So this is what the mental picture of the carbovage. Mostly carbovage is a thirsty remedy because carbon has absorbed the water very readily. But in acute condition, you can think of dull, hot, and thirstless. So most of time the carbovage, other indications, they are very quiet, slow, confused, sad, and silent. So as you know, the carbons are very timid, right-sided, slow, and confused kind of personality. Again, the carbovage is the carbons is a sarcastic personality because they have a emotions anger, but they cannot express their anger due to timidity, and they express anger very intelligently in the form of sarcasm or mocking. So if they do sarcasm and mocking as if they are deeply hurt, the physical stasis or the slowness of the all the system causes offensiveness of the discharge, especially the stool, urine, and perspiration. So this is what the physical indications when you think the carbovage. Again, we all know the carbovage having a seat of actions on the GIT and the cardiovascular systems and the liver. So when you find that the fluctuation with the history of jaundice in the past, you can directly think of carbovage. Excessive perspiration yet wants fan, chilly in collapse, or hot in infective acute illness. So this is what you have to understand in the acute state. So there is excessive perspiration yet wants fan. There is also the same the state in the collapse like camphor. The camphor is also same state. There is excessive perspirations and the collapse state, and they want the fan. But in camphor, they want the fan again. They like the covering, and then again they feel heat, and then remove the covering. Again they want the fan and everything. So this is what the phenomena you can think of. The camphor is the remedy. But in carbovage, there is a cold, calm skin and desire for the fan is the indications, along with the shortness of the breath, stasis of all systems, and slow, dull, and confused constipation. There is a slow portal circulation causing piles, jaundice, cramps in the leg, varicose vein, and the headache. These are the indications of the chronic carbovage, and they suffer from this type of the chronic disorders. So whenever you find the features of the dull, hot, thirstless, along with the dry mouth and no thirst, with the non-diligent personality and desire for the fan in acute and air in the motions, you can think of carbovage. If you have the dull, hot, and thirstless personality, along with there is a most mouth, so observations of this PQRS face or a mouth that gives you a two different remedy, that is a lactasis and sulfur. There is a moist mouth. So as you know, the lactasis personality comes to your clinic and sulfur personality both comes to both are extroverted in nature. but legacy is having a high intelligence, whereas the sulfur has also intelligence, but the sulfur talk is something which is different than the legacy. Because you, when sir always says the legacy is called as Mr. Google. They knows everything from the Googles and everything, whereas sulfur is also knows everything. But what is that? Jack of all and master of none. That means he knows everything, but when you go deep into it and asking deep in them, they will not answer you and they will manipulate you. So that is what the sulfur. So legacy is jesting on the disease and takes lightly. The key indications of the legacies is the most of the complaints or aggravations after the sleep and during the sleep. So this is what the key indications of the legacies personality. Their sensitivity to the throat is most important, and they cannot tolerate the tight clothing around the throat. Even there is the affections of the throat is there, and they usually justing with the complaints. So the environment of your what we called as the clinic has been changed when the legacy's personality comes to you. Again, very important aspect of understanding that the legacies is very watchful in their nature and they are very good observant. So I used to share one of the case of the young girl, almost around 2 year, 2.5 years old. So one fine day, I used to put the Hanuman sir photo in my clinic, so it was put on the table. So that child came to clinic and she had a fever and everything. The mother is giving history, but the child was asking me one questions that by looking at the photo of Hanuman and she asking me questions that where is the ear of this man? So surprisingly, I had a photo of Hanuman sir since many time, but I cannot observe that observations of the child. So this is what observations of the child, that is called watchfulness even in acute conditions. So on the basis of that, I prescribe laxatives to that child and that child recover very well. So many a time adjusting with complaint, that means what the person who wants to, okay sir ये तो ठीक हो जाएगा मुझे पता है आप अच्छी दवाई दे देंगे. Or sometime I generally I have not prescribed on the basis of jesting, but I just prescribe on the basis of the sensitivity of the throat, and there is a sleep aggravations and there is what we called as even though one of the indications that I used to check in the legacies patient, that I generally advise open the mouth and protrude your tongue. So whenever you find a trembling of the tongue in acute conditions with the moist tongue, you can think of legacy. So this is what something you can think of. Jesting can be anything. They can jest on anyone. They can jest on the disease also. I will not share here the example of that, but I have not prescribed on the basis of jesting. I just prescribe on the basis of the sensitivity, prescribe on the basis of the sleep aggravations during and after, and most of time the patient comes with the throat congested. It was congested with there is a liquid aggravation. So this is what you can think of. Lechosis is one of the remedy. The other indications of the lechosis, most of time the loquacity is there in lechosis because the lechosis when goes into sorosyphilitic state, there is a loquacity, so their speech becomes so fast and they having a loquacity changing from one subject to another subject. Erectations, hiccup with the fever. This is the physical particular concomitant symptoms. You can think of weakening actions and perceptions and night into aggravation, sleep into aggravation for waking after aggravation. These are the few indications of the legacies personality. When you have found that the person having a dull, hot, thirstless, even thirsty also there is a legacy. Okay. And there is a moist mouth with the trembling of the tongue, sleep into aggravations. So these are the few indications of the legacies. If you have the remedy that is a dull, hot, thirstless, and moist mouth with there is anxiety about the disease. As I have told you about the anxiety about the disease is there in the sulfur, also in the lycopodium, but lycopodium go for the investigation, whereas the sulfur won't. So this is what something you have to differentiate from the lycopodium about the anxiety about disease. And one of the key indications of the sulfur is something that you think of the distributions of the heat in the body is altered and there is a hotness of the palms and the soles. So whenever you find there is a hot palms and the soles in acute conditions, you can directly think of the sulfur is the remedy. So the excess of the sulfur, dull, hot, thirstless, or the thirsty, it can also be found in the anxiety, mental anxiety, hot and thirstless, or the thirsty. Even in sleep overpowering, we have seen that the sulfur. So this is sulfur can be anywhere, everywhere is there. Along with there is a sulfur, the Boger has given the idea that the red orifice. So all the orifice of the sulfur is a red. So the lip become very, very bright red. So whenever you observe this redness with the hot palm, you can directly think of the sulfur. Okay. And the sulfur is mostly the angry on himself. Nux vomica is also there is angry on himself. So you can think of Nux vomica is acute of sulfur. Nux vomica is chilly, sulfur is hot. Internally, very, very anxious about and anxious, but bursting open with the anxiety at night at 1 a.m. So mostly you can think of the arsenic-like personality angry on himself when feeling ill, and there is a red issue on the face with the palm hot, red and hot. So once you find out there is a redness on the orifice or redness on the face, like what we call as a red lip, directly observe the palms. If the palms is hot and person is dull, hot and thirsty or thirstless, you can directly prescribe the sulfur. This is what the acute understanding. Most of time I observe the sulfur patient comes to you in acute conditions with the messy hair. So there is aversion to bath and hair episodes or messy hair and there is a dirty appearance and indifference to external appearance. This is the PQRS symptoms of the sulfur in acute conditions. Even there is anxiety about health, yet not ready for any investigation, not even measuring the BP. So this is what something you can think of the sulfur. So hope you all understood the understanding of the dull, hot, thirstless remedy with the filter of the physical PQRS, with the filter of the diligency and non-diligency, and then the particular PQRS and the basic dispositions of the particular remedy. So whenever in acute conditions, you need to find out the activity which is dull, person is thermally hot, and thirstless. You have to keep in your mind these are the few remedy comes into your mind and you have the handy tips, so you need to ask a certain question to rule out and rule in the remedy. Hope you enjoy this learnings and you get benefit from this. So if you have any benefit from this and you have cured some cases in the short span of the time in acute condition, please do share your case in the group, in the WhatsApp group also, so that all other can learn from your experience also. I am just what I am doing here is always sir always says I am giving you a process of fishing. So once you learn the fishing process, then you will eat for the whole life. And if I give you a remedy directly, that you will not learn the process of fishing. So this is what I am doing right now. So I am teaching you the process of fishing, and when you get this type of phenomena, just apply your experience and you will get the result. Okay, there are only two possibility: either you get the result or either you learn from that experience. So there is only two things happen whenever you apply your knowledge into experience. So thank you so much. We conclude the day today here. In the next sessions, we will concluding the dull, hot, thirsty remedy, followed by the activity increase, the mental activity increase, the physical activity increase, and the verbal activity increase. So we will conclude this at the end. So today we will conclude this day. Thank you so much. Renal stone conflict. are you going to treat the conflict or are you going to treat the constitution? So whenever, see, what I am doing many a time, when you learn new things, na, then you have a idea that you need to get things very easy from this. But whenever you apply these things in your practice, you will be stuck up somewhere that this conflict cannot get. So you cannot get what you want in the case also. So don't go behind the conflict in the initial stage of practice. Whenever you have a far beyond practice and you don't have a time, then you directly ask the questions according to conflict and the person will give you the idea. But many a time you need to understand that like renal stone is a psychotic disorders, psychotic disorders, or accumulative pathology. So in that depositions of the stone is there. So in that you need to find out the real intellect, moral attachment, and sensitivity of the patients from this whole history. And according to that, you prescribe the remedy. You will get the wonderful result. But when you go behind the conflict, you will stuck up and you cannot get what you want in the case taking. So I must advise all learners, go for the conflict when you have a lot of patience and you don't have a time to search for the whole history. At that time, you can apply the conflict theory. But when you have the whole history and the disposition, apply that and you will get the wonderful results. Most of time the renal stone is happening in the pelvis, so there must be some insecurity happening due to what we call as the insecurity related to the territory marking conflict. So that means that they want to mark something and there is an insecurity, so they having a losing something from their share. So when there is a losing something for share, they start accumulating something in their kidney. So this is what the basic conflict behind that. And from that conflict, you cannot get anything out of it. But for that, you need to understand the man as a whole and prescribe on the basis of real intellect, moral attachment, and sensitivity. Hope you take it as a positive things, because uh, the conflict theory will help to certain extent, whereas the miasm theory, what Dr. Vijayakar sir has taught us, that help you to treat the patients in the deepest level. So the conflict theory gives you a general idea, whereas the miasm theory gives you a particular, and at the end you can get the result with the miasm only, not with the conflict. So thank you so much. Thank you all. Have a great day. So we conclude the day today. Thank you.